welcome to this edition of OT News. I'm Tara Dyson.
And I'm Natalie Goniometer.
And we have breaking news for you today, folks. There's been a recent outbreak in our province that is spreading throughout the world rapidly. This illness has been identified as Guillain-Barré syndrome, also known as GBS. Yeah. Oh wait, I think I'm getting something. I'm getting something here. Okay, yeah, we just received confirmation that an outbreak has occurred in close proximity to Corbeil. Yeah.
Oh dear.
I know. Fortunately, though, we do have a reporter on location who can report on this case. So we'll send it now to Jessica D. Ring. Jessica?
Yes, Natalie and Tara, I'm here in Vegreville, the location where the Guillain-Barré syndrome outbreak occurred earlier this morning. I was able to get a few minutes to talk with Dr. Hooper, the doctor who treated Anne when she came into emergency in the hospital scene behind me. Right there. He said that Anne is a 31-year-old female who was forced to pull out of a marathon because she was experiencing flu-like symptoms, tiredness, and extreme difficulty breathing. Upon review of Anne's symptoms and problems, which include muscular weakness in both the upper and lower extremities, fatigue, and no ability to function independently anymore, Dr. Hooper diagnosed Anne with Guillain-Barré syndrome. Anne currently resides with her husband, who serves in the Army, and her daughter in a split-level bungalow on the military base. At the time of the incident, Anne was a local aerobics instructor and was thought to be in peak physical shape. So my question to you is, what happened to this young, beautiful woman?
Thank you, Jessica D. Ring. But could you please give us a little more information about this condition?
Just to give you some brief information on Guillain-Barré syndrome, it is an acute condition in which a person's immune system attacks the peripheral nervous system. This results in the body's demyelination of sensory and motor neurons, which ultimately causes severe weakness and numbness that typically begins in the extremities and then spreads rapidly throughout the rest of the body. Do either of you two ladies have any other questions that I could hopefully answer?
Yes, Jessica, we were just wondering why you aren't wearing a mask. Isn't GBS contagious?
Actually, no, Natalie. Guillain-Barré syndrome is not contagious at all. So I do not need to be wearing a face mask or taking any other universal precautions, but thank you for thinking of my safety. Well, if that's all, ladies, then I will turn the rest over to you at the station, and have a good rest of your day.
Thank you, Jessica.
Yes, thank you.
Research has shown that the incidence of this illness is 1 in every 100,000 people.
Wow.
And does not differentiate between ages and sexes.
Wow.
While the exact cause is not known, research has also shown that it may be caused by a virus, surgery, or vaccination, Tara.
That is some heavy stuff there, Natalie.
It is.
Major. All right, so the common symptoms for GBS include weakness, tingling, and loss of sensation, beginning in the lower extremities and then moving in a feet-to-head manner.
Tara?
Yes, Natalie.
You mean in an ascending fashion?
Yeah, that's what I mean, in ascending fashion. Also, there is muscle paralysis, a difficulty with eye and facial movements, speech, chewing, and swallowing, low back pain.
Oh.
Yeah, that'll get you. Impaired bladder and intestinal functioning, slowed heart rate and lowered blood pressure, and difficulty breathing.
That does sound like fun.
No, not fun at all.
Apparently, there are 3 stages that characterize the progression of this disease. The first stage is acute onset, which begins with when the first symptoms emerge and end when no other symptoms are identified. This stage typically lasts 1 to 3 weeks. The second stage is the plateau period, which is marked by no significant decline or improvements. This period can last from several days to several weeks. The third and final stage is the recovery phase, which includes remyelination of peripheral nerves and axonal regeneration.
Wow, wasn't that a mouthful, Natalie?
I practiced.
All right, So current medical treatments for GBS include a diagnosis which is made through spinal taps and nerve function tests. Although there is currently no cure for this disease, 2 treatments are commonly used to help speed up recovery and reduce the severity of symptoms. These 2 treatments are called plasmapheresis and IV immunoglobulin.
Good job, Sarah.
Thank you. Also, GBS recovery of all or most functions occurs in approximately 90% of all cases.
That's positive.
That's good news.
Yeah,
It's just
we
great.
like to hear that here at Corvée.
We sure do. We are now going to turn the segment over to reporter Roger Rojo. Roger?
I am here with Anne's occupational therapist, Rochelle Saskapol. It is so wonderful to meet the great inventor of the Saskapol. So Rochelle, I was wondering if you can tell me a little issues about some of the Anne and Anne's families are facing right now.
Sure, Roger. Well, I like to use models to better understand the client's occupational performance issues. The model that I use in my everyday practice is a Canadian model of occupational performance and engagement. Here, I would assess Anne's physical, cognitive, and affective conditions, as well as the occupations she engages in her environments. Currently, Anne is experiencing muscle weakness, fatigue, poor physical endurance, and decreased respiratory functioning, which will impact her ability to perform in her self-care tasks, teach her aerobics class, manage household tasks, take care of her daughter, engage in leisure activities such as marathons, and also socialize.
Very interesting.